So the next step is the ST segment, which is the interval between the end of the QRS complex, what we call the J point, and the start of the T wave. Now, what the ST segment is, it represents the portion of the action potential known as the plateau phase. So after the cells have been depolarized, but they've not yet been repolarized. Now, this segment can be altered, meaning elevation or depression of the segment, in a variety of conditions. When we're measuring the movement of the ST segment, so ST elevation, for example, we measure at the J point. And importantly, we compare it with the TP segment, especially if there's only subtle ST elevation. It's better to use the TP segment. Now, as I said, there's many causes of ST elevation, and we will cover a lot of these in the future. But just to give you an idea, bundle branch blocks, which are pretty common, can cause ST elevation, pericarditis. You can even find ST elevation in healthy individuals. It's always important to exclude a myocardial infarction when you do have ST elevation. Now, moving on to the T wave represents the repolarization of the cells. So the T wave is typically positive in leads where we have a predominantly positive QRS complex. Now, the normal T wave is slightly asymmetric in the sense that the upstroke, as you can see here, is slightly more gradual than the descent. There can be different abnormalities that we can see of T waves that can point to a few different pathologies. Now, T wave inversions can mean a variety of different things, and we're going to talk about this in a few videos' time. Tall peaked T waves we find in hyperkalemia, as you can see here, and deep T waves, again, you can find in a few different circumstances. In some cases, when you have CNS pathology like a hemorrhage, you can find these deep T waves. Going back to T wave inversions, it's also important to think about what is a T wave inversion. A lot of people get this confused. A T wave inversion is when the T wave and the QRS complex are going in opposite directions. So for example, in a lead where we have a predominantly positive QRS complex and we see a negative T wave, that would be a T wave inversion. Alternatively, if we have a predominantly negative QRS complex and a positive T wave, that would also be a T wave inversion. But isolated T wave inversions are not very specific, especially if we see them at transition points. Like, for example, you can see here V2, you can see that the QRS wave has gone from being positive to negative, and there's a T wave inversion here. This is quite common, and although the axis of the QRS complex and the T wave is pretty similar, it's not perfectly aligned, so you can get some T wave inversions at a transition point like V2.